My name is David Wade, and I am one of the day room staff at the CCC. We open up by preparing everything. We come in an hour early and get the coffee ready, get all of the showers cleaned and ready to go, prepare the laundry, make sure everything is set to go, and then we coordinate with the other services that are in the building. So on any given day, we'll be getting people connected with their mental health provider, or with a doctor from Providence, or wound care with the free clinic. And Sidewalk is here 4 days a week. The community care center is not an end-all answer to the problem, but it is a beginning.
Good morning, my name is Theodore Sanchez. I come to this center looking for resources. There's lots. It's awesome that it's here. I think you're giving more than we deserve. I can be really honest there. Everybody here has hope, but we have to guide them. We have to walk them through it, not just hand them.
I'm Betty Hauser. I'm a navigator here at Sidewalk. The navigators interview people, ask them all the needed questions, and then do what we can to get them on the right path to finding housing. The biggest barrier is finding a place people can afford. People used to find even little apartments for $500 a month. A lot of our clients only get $750 if they're on disability, and a lot of the homeless are on disability. Now that we're down at the community care center, even though I could have easily communicated with people like Bo and Silas from the Interfaith Works Shelter, now that we're here and I see them occasionally, I am doing more communication with them. I really enjoy helping the people who really need the help most. And there's nothing more basic than a place to live.
My name is Michelle Halverson. I was fleeing a domestic violence situation, and I was staying at Safe Place. And then after my time was up, I went to a friend's, and then I've been homeless for a year, and I was staying at Interfaith. So yeah, I've gotten a lot of help here. Mental health, showers, washing and dryer. There's a outreach worker named Anne, and it was just kind of, she knew somebody that bought a house, remodeled, and wanted to rent to people that are on Social Security or a lower income and able to use Sidewalk's funding. So I've been there for like 5 days.
Hi, I'm Brandee. I am the Providence mental health provider at the community care center. So predominantly in the mornings, I kind of round on individuals that I'm already established with and check in with them kind of about what their needs are right now and help them to prioritize what the first thing is that they're going to do. Often it is, have you taken your medication yet today? And then I kind of structure who wants to meet for therapy and then who I need to do more case management related things with. You know, what I would say is amazing about the model down here is our approach. We have the interfaith staff that are working in the day room that are just incredible at meeting people where they're at. And the way that we work is we all just kind of wrap around someone to just ensure that they're safe, that they have a point of safety here. It has been so pivotal to have Sidewalk here. The Olympia Free Clinic is amazing. We coordinate with them a lot.
My name's Michael, and I volunteer for Grub to take care of the garden here through harvest, and this is a beautiful garden here. Okay, how the services help me here? First of all, I take showers here. And I also go to the free clinic, which cleanses and heals wounds, gives us medical supplies for stuff like this. This is a great place, and we're just glad it could be in our community.
Dr. Mike Matlock, and I work at the community center because I'm the medical director for the free clinic. So we see all kinds of problems here at the center, acute and chronic. I think we're able to help many people and avoid them having to seek care in some other venue like an emergency room or urgent care. I had one patient where I was working closely with Brandee, one of the mental health providers here, in terms of taking care of this patient's medical needs and doing it in a way that worked with his mental health issues. And that's just an example of how this location really lends itself to doing things in a much more coordinated teamwork sort of fashion. You know, both the foundation board and the community board for Providence are firmly grounded in the mission of Providence. And I feel like this center lands squarely in the middle of that mission statement, in terms of being able to address the needs of the most vulnerable. I'm proud as a community member and a community board member of Providence that we're engaged in this effort. I think the more that we can provide for these individuals, the better the chances that they'll find housing, that they'll get integrated back into the workforce, that they will be able to not have to live on the street anymore.
It's Elizabeth Blake, but I go by Liz here on the streets of Olympia. I just became on the streets since I think 2013 and just been on the streets off and on. When I've had like physical issues like ear or my throat or something, they'll help me out. A few weeks ago, a few ladies came in with literally white t-shirts and different colored paint and stuff, I guess you could say. They actually got in with the homeless and actually helped, and they showed us how to make them, and this was really fun. So yeah, there's a lot of the homeless people that come in and go from here that have made some. This is my hometown, and I've seen a lot of changes, and honestly, with the community care center, this was a good change. This is what the homeless needed, was the community care center, people who actually cared about them and who are willing to be there and help them and be a listening ear.
My name is Heather Kranz. I work for Behavioral Health Resources. I'm a licensed mental health counselor, and I'm based down here at the community care center. What we're working with down here is people who have not been able to make it in traditional services. They're people who have fallen through the cracks, who have not been able to make appointments, who have not been able to engage in any sort of traditional treatment, whether that's mental health or drug and alcohol. So it's been really great having people down here that can help them navigate that system. People are able to just walk in, say, hey, I want help, get immediately sat down and do a drug and alcohol assessment. They help walk them through the detox process. They help them find a bed date. One of the things that we're really trying to cultivate down here is a culture of recovery. And I think that what you see is you'll see, one person will kind of come and say, hey, I've gotten clean. I've got 3 days under my belt. And they'll say, oh, and my friend, they look at me, they say, oh, you've got 3 days clean. I can do it too. And so now their friends are working on being clean. And then their friends are working on being clean. And then we have this whole culture and this whole setup of people who are working towards recovery. I think the one thing that I wish everybody knew about homelessness is that it's different for every single person. One story I particularly think about is that we got a call from the transit center who said that they had an elderly lady there in a walker who seemed confused and didn't know what was going on. We were able to bring her over here. It sounds like she had been in a domestic violence situation. She has a lot of medical problems, had been living in a truck with her boyfriend, and he dropped her off. And so the transit center called us, and we brought her over here. We were able to talk to her and connect her with Sidewalk. We found out that she had a sister a couple states away, so we were able to call the sister, contact them, and then Sidewalk was able to use their Ride Home program to get her a Greyhound bus ticket back. So I think that collaboration that we're seeing, where it's like the transit center is able to look and say, wow, this is a really vulnerable person, and then call us, and then we're able to get them connected and get them sent home, is really powerful. Everybody wants a better life. Nobody wants to be unhoused. Everybody's looking for the same thing. They're looking for safety, security, and help. And those are the things that we're looking to provide down here.